Main concerns, cancer, especially breast and cervical cancer. A lot of them come for screening for that. Second one would be HIV/AIDS. So I think from the latest report that we've just received, unfortunately in South Africa there is a higher prevalence of HIV/AIDS in women. There's a lot more newly diagnosed women than men. That's a trend that we have picked up in the last few years. So that's become a huge concern and something that I check for, especially in a lot of my female patients. The third thing I'd say is pregnancy and fertility issues. And probably the last thing that would be mental health issues, especially depression. Women take on a lot of responsibilities. A lot of them are, the breadwinners, or they have to juggle. They struggle with the work-life balance. So with a lot of the women, they do come in with the consequences or side effects of taking on too much. So I do tend to come across a lot of mental health issues, especially stress, depression, anxiety in women. So, the preventative measures, these are part of the annual checkups that we do ask patients to come in for, and especially with women. So in terms of the breast, we do annual breast exams, and we also teach women actually how to do even just daily breast exams at home. For women over the age of 40 or where there is a family history, then we also recommend, or we send them through for mammograms to check for any early or just signs of cancer. In terms of cervical cancer, that's where the pap smears come in. So for anyone that is sexually active, any female that is sexually active, does need to have pap smears done. The current recommendations, so just depending on where you are, the global or just the national recommendation at the moment is to have a pap smear done once every 3 years. If there are no abnormalities, but if there are any risk factors, then it might be something that is done every year, and that helps us to pick up especially early signs of cervical cancer. As mentioned before, HIV/AIDS, getting tested at least annually. To my patients, I even say biannually. So that's part of the checkup that we do. And lastly, when you do come for your wellness checks, as I said before, we do go through a mental health screen. So we talk about, mentally, how are you doing? How are your stress levels? And, we go through, all those questions about sleep and appetite and mood to try and see if there are any features of depression or anxiety or fatigue or burnout. So essentially, go for a wellness check where obviously the physical checks are done, which is the breast exam, the pap smear is being done, and as part of that, the blood pressure will be checked, the sugar will be checked, and then there'll also be a conversation around current mental health state. So preventative measures, and then going into what we talked about in terms of wellness, following a good eating plan, exercising, or essentially not being sedentary, and then also having a good social network, engaging with family and friends, because those are things that are good for your mental health. So essentially, at the moment in health, we break it up into two. There's two age groups. So there's those that are less than 40 and those that are over 40, especially with females. So less than 40, or essentially those are the fertile or pregnancy, young adults. So the focus there in terms of women that are less than 40, obviously the big thing that's happening during that time of their lives is that is when women are having children, so it's pregnancy and fertility issues. So there tends to be a huge focus on that. And then in terms of wellness, it's the basic wellness. So obviously, as I said, your pap smears, just checking your blood pressure, checking the blood glucose, just doing your normal health checks. But in that less than 40 age group, you find that a lot of the concerns, a lot of the issues are around pregnancy and fertility. So when we're doing health checks, obviously we have a lot of discussions about that, and if there's any issues in terms of that, we focus more on that. Over the age of 40, obviously a lot of women are heading towards menopause. So for most of them, menopause, a lot of people will always ask you, when is menopause going to start? Unfortunately, it's different for everyone. With a lot of women, I actually tell them, check your family history. Chances are you will, ask your mom, ask your aunts. Generally, in terms of the family, if your mom and her sisters, menopaused early, chances are you'll also menopause early if it was late, so they can give you a good idea. It's not easy there isn't a specific age. There are those who menopause early and those that menopause late, but that becomes a big topic of conversation over the age of 40. Over the age of 40 also, we focus more on, that is when especially your mammograms and your breast exams are more important. So the current guidelines is that basically women over the age of 40 should be getting a mammogram done, ideally annually. So that's when we start doing mammograms. Another health check that we start adding in over the age of 40 is thyroid screens. So it's something called a TSH, or a thyroid test. Abnormalities within the thyroid start to come more over the age of 40. So that's another health screen that is now added to your normal annual screen. And then obviously those big diseases, the hypertension, the diabetes. As you know, the older you get, that is when, if you are at risk of developing those disorders, they tend to start featuring at that over 40 or at the older age. And then with going into that, we start looking into things like arthritis, your osteoporosis, bone health. So that's where the focus is then over the age of 40. So screening early, essentially it helps us to pick things up early. And I think, as I've mentioned before, the earlier you pick up something, especially if you're looking at something like cancer, if you pick up precancerous changes or you pick up a stage 1 cancer, it is much more manageable and even curable than picking up a late stage or a grade 4 cancer. So the earlier you pick up on something, the easier it is to manage. And with a lot of the things, yes, there are some things that you can pick up that you can't fully cure, but you can manage. And there are those things that if you pick them up early, especially in terms of, and I'll talk about cervical cancer and pap smear. So pap smear is the reason why there is such a focus on doing them regularly, and ideally getting them done. As you said, there's those that actually get them done every year or every 3 years. The big thing about cervical cancer is that it's a silent cancer. Breast cancer actually also has the same tendencies. It's a silent cancer. Most of the time, by the time you have symptoms, so when you talk about symptoms of cervical cancer, by the time you're having low abdominal pain, by the time you're having abnormal bleeding, you are at a late stage. So those symptoms only come in when you are in the later stages of the cancer. And in the later stages of the cancer, management or even doing something that can ideally cure the cancer, it's a lot more difficult, because when you're at the late stages of the cancer, most of the time the cancer has already even spread or metastasized, as we said. So the big thing about cervical cancer is that because it's a silent cancer, you can sit for 5 to 10 years with cervical cancer busy growing and spreading in your body, and you have absolutely no idea. And then one day you start experiencing low abdominal pain, you start bleeding or spotting, you go to the doctor and you pick up that you've got stage 4 cervical cancer. and it's been building, and you'll ask that patient, when was your last pap smear, and they'll say 10 years ago. And that is something that will honestly break your heart, because if you had been going for even just every 3 years for your pap smears, we would have picked it up. Because when you do pick up early changes, so when somebody comes for a pap smear and it comes back abnormal, there's abnormal early changes, that is something that is completely curable. If there's abnormal early changes or even early cancer, we send you to the gynae, we send you to the oncologist, and it's something that can be totally managed and even cured if it is picked up at that early stage. But it's a problem when you're coming in and you haven't had a pap smear done in a decade, and we pick up the late stage cancer. So that is the importance of, because people say, why do I need to go for pap smears? You need to go for pap smears because cervical cancer is not something that when it's there, it doesn't show itself. It doesn't show itself from day one. It will show itself 5-10 years later when you're in a lot of trouble and when you're in the later stages. So similarly with breast cancer or breast exams, obviously we talk about, checking for lumps, checking for any changes on the skin of the breast, checking for your nipples. So breast exams, something that you can actually do on a daily basis. So with a lot of my patients, when they do come in for their wellness checks, I will do a breast exam, but I also show them how to check their breasts at home. And I mean, checking your breasts, it's something you can do on a daily basis. You can tell yourself on a weekly or even on a monthly basis, you're going to do your own breast exam at home. And if you pick up any abnormalities, you go to the doctor, because you know your body, and as females, your breasts. So when there is some lump or something that you're seeing that should not be there, then you can easily and quickly come to the doctor. And the same thing as I've said with cervical cancer, early changes, early grades of breast cancer, manageable, curable. But when you come at a later stage, or you've been sitting with this lump for 5 years, 10 years, and now it has grown, it has spread, things become a lot more difficult. So that is why there is such a big focus on let's get screened yearly, let's go for our checks, because when we pick up things early, we can manage them a lot better, and with some of the things, we can even cure them. So I think the one saying that I love in the Zulu language is that melimpilo yako, stand up for your health, stand up for yourself. No one else can do it. No one else will do it. It's all on you. It's the choices that you make. I know with women, and there is a lot of anxiety, there's a lot of fear about getting pap smears done. And I know women talk to each other, as friends, and they'll tell you, hey, or it's uncomfortable. I sit with a lot of my patients. I mean, as a female myself, I get pap smears done, and what I'll tell you is that a lot of the fear, a lot of the anxiety, a lot of what people hear from the outside about getting a pap smear is not true. So let's remove the fear, let's remove the anxiety. Because I say rather live through, because pap smear, it's not a long test. It doesn't take an hour to do a pap smear. On average, to be honest, it takes about 2 minutes to do a pap smear. And I say to most women is rather 2 minutes of discomfort rather than the diagnosis of cervical cancer, where now you are fighting for your life. You are, going through cancer treatment. You are going through all that pain. So, weigh that. Either 2 minutes of discomfort once every 3 years versus dealing with cancer. So my big message is that, stand up for your life, stand up for your health. And if you have any concerns, go and speak to the doctor rather than asking umngane ukuthi, how did your pap smear go? Because everyone is going to tell you something different. Rather than going on to, Google, that might scare you out of even going to the doctor, just go to your doctor and, speak to your doctor about doing the test, and speak to your doctor and tell them that, listen, I'm scared to do this, and you know what, we'll get through it. We'll get through it. And as I said, it's a very quick test, and, I do my best to make sure that my patients are as relaxed and as comfortable as possible, and to ensure that the procedure goes as smoothly as possible. And a lot of my patients will tell you, if you come in here and we talk about it and you're relaxed, it actually goes by very smoothly. And as I said, wait 2 minutes versus, dealing with cancer. And it's the same thing, with your breast exam or going for your mammograms. And also same thing with checking your blood pressure, checking your blood sugar. It's a quick prick. Getting an HIV test, it's a quick prick. So rather do that than, now you're dealing with specialists, you're in hospitals, in and out, and we're dealing with, those things that we don't want to deal with, because now we missed the early diagnosis. So with chronic conditions, when we're managing chronic conditions, when we diagnose and then when we set a management plan in place, management plan will always have two arms. There'll be the medication or the pills, and then there'll be the lifestyle changes that you will advise a patient on. So that's where I think your question comes in. So, and I'll focus more on your high blood pressure and your diabetes. It's not just about taking your pills every day. You do need to make some lifestyle changes to also help to manage or control the blood pressure or the diabetes. And also these lifestyle changes will actually prevent you from developing the side effects or the deterioration that comes from not being controlled. And in some instances, the lifestyle changes can actually help to lower the blood pressure or help keep your diabetes in control. So when we talk about these lifestyle changes, it's usually centered around eating plans. So with the hypertensives, we talk a lot about lowering their salt intake, stopping the smoking, exercising to try and improve heart health. With your diabetics, obviously, you have to have a big conversation about lowering the amount of sugar in their diet, just so they can stay more controlled. But also you have the same conversation with them that you have with hypertensive, because you honestly don't want to get to a point. So diabetes and hypertension sometimes go hand in hand. Sometimes, and especially with diabetics, that you'll pick them up as a diabetic, a year later now they're hypertensive. So they're good buddies. So they tend to invite each other to the party. So it's pretty much the same advice, and it's advice centered around how they eat, or the new eating plan. It's about exercising. It's about cessation of smoking, and it's about also mental wellness, because a lot of those, the minute you diagnose somebody with a chronic condition, you have to go into the mental aspects of that. It's not easy to be told you've got hypertension. It's not easy to be told you've got diabetes, and especially with younger patients. We have a lot of my younger patients they're very reluctant, when you pick up that diagnosis and you tell them that, listen, you've got high blood pressure, we need to start managing it. So those are, in terms of the preventative care measures, other than just the tablets or the pills that they start. Half of it is that, the other half is things that they need to do now in terms of their lifestyles to manage or even improve their conditions. So empowered patients, informed patients, as you've mentioned, are compliant patients. So firstly, people that know about their diseases or their disorders. So people that they know the definition of what it is that they're going through, first of all. Patients that know about the medication that they're on. Patients that are aware of the lifestyle changes that they have to make and already have made those changes. Those patients are controlled patients. Those are compliant patients, and those are patients that are stable. So if you're empowered, you end up being the stable patient, and that's what we want. That's what we want as doctors, and especially when it comes to chronic conditions. The other great thing about empowered patients is that they can also help to educate others. They can help to educate their families and their friends about not just what they're going through, but they are also able to pick up. They'll find umalume who's suffering from headaches, is having swelling, and they can tell them that, hey, you know what, when I was going through this, I went to my doctor, and that's how my high blood pressure was picked up. So the great thing about somebody that is empowered, somebody that is educated, is that they can pass on that knowledge to friends, to families, to colleagues. So the big thing about empowering someone, and I think it's within every aspect of life, people who are empowered empower others. So which is why it is such a big thing for us, even as doctors or as healthcare workers, to always ensure that we empower and we properly inform our patients so that they can not just have that for themselves and take better care of their health, but also so that they can pass on the knowledge to their friends, to the community, so that we can all get to a point where, because what is the ideal end goal? We all want to be empowered, and especially obviously we're talking about health. So if you empower someone, or if you enable someone, they are able to go ahead and empower and enable someone else, and hopefully that becomes a domino effect, and you reach that end goal where we are all empowered and we are all in a good state of health.